Hello, welcome back to the podcast. So happy that you're back here with us today. And wow, guys, buckle up. Today's episode, game changer. I mean, aren't they all? Gosh, they're like, it's just so amazing how many different ways we can use ketamine. And today's episode is no different in that it's presenting a new way to use ketamine, it's presenting a new point of view. And if you've ever thought of ketamine as just a mental health treatment, I want you to get ready to have your mind absolutely blown because I had the absolute pleasure of sitting down with Kristen Johnson, who has been in the healthcare and clinical research world for over 30 years. I mean, psychedelic space in the past 30 years, can you imagine all that she's experienced? I mean, she does clinical research in addition to what we talk about in the episode, and we touch on it a little bit, and I'll say more about it, but she's really doing some of the most incredible work helping people with chronic neuropathic pain conditions like CRPS, complex regional pain syndrome, which honestly, guys, I didn't even know much about before sitting down to record this episode with her. But yeah, she's using ketamine to help people with this chronic neuropathic pain like CRPS that we'll talk about more in the episode. So if you're not knowledgeable about it, like I wasn't, don't worry about it. We get into it. And also, I just want to say what a joy Kristen was to meet, to connect with, and to have on the show. Kristen is one of those people who is so deeply committed to learning, to growing, to finding real solutions for the people that she serves. She didn't just stumble into this world. Guys, 30 years, she built it. She built it from the ground up, fueled by this genuine sense of curiosity, of compassion, of unshakable desire to help people find relief. Now, I know that on the show, we talk a lot about how ketamine has a really huge impact on depression, anxiety, and PTSD, all of that good stuff that is much more higher in clinical trials. But what Kristen is doing is different. She's using high dose, long duration ketamine protocols to treat some of the most excruciating pain that is known to medical science. I mean, we're talking about pain that ranks higher than third degree burns on the pain index. And there's nothing that helps this pain. It doesn't respond to opioids. Like, it's pain that people live with for years that has no real solution except until it started being treated with ketamine. So Kristen has been in this game since 2016, before it was cool, before people were even whispering about ketamine for chronic pain. And let me tell you, some of the stories she shares in this episode are just so cool. Like her patient Kevin, who had not worn a shoe in 5 years because of the unbearable pain in his foot until ketamine changed his life. When I first heard about Kevin, I don't know why, I just imagined someone living in long-term chronic pain was older. Homeboy was in his 20s. Like, he had his whole life ahead of him and he hadn't worn a shoe in 5 years. And then we get into the episode. He stumbles upon this treatment. He gets help from Kristen and he's wearing shoes. He's walking again. He has a job. He's got a whole quality of life that is returned to him because of this treatment. It's unreal. People are getting their lives back in all sorts of ways through this innovative treatment with ketamine. So we get into it more into the episode, but they're longer treatments. They're full on. They go for 10 days. She splits them up over 2 weeks, and they are like a literal deep reset. It's like a full body recalibration and a really, really solid long-term transformation. So you're in for a treat, because in this episode, we dive into why nerve pain is completely different from any other types of pain and how ketamine actually works to reset the nervous system. We talk about the difference between ketamine for mental health versus ketamine for pain, and why getting the wrong protocol could make or break your results, right? We talk about the life-changing effects of this 10-day ketamine pain protocol and why this could be and maybe should be a first line of treatment instead of a last resort. And we talk about what's next for psychedelics and chronic pain, because Kristen also runs a clinical research center. And so she's doing research into MDMA for pain relief, into psilocybin for chronic conditions, and even LSD for anxiety. Like, does this woman not have the coolest freaking job? Like, come on. Her passion for research is just incredible. She's not just running a ketamine clinic, she is actively involved in clinical trials. She is pushing the field of psychedelic medicine freaking forward, guys. And gosh, like, what a treat. She is looking at how ketamine, MDMA, other psychedelics can be used beyond mental health, because we all know that our issues are in our tissues. So if we get those issues out of the tissues, we got some hope coming our way. So, yeah, pain is not just physical. It is so multidimensional. So, this episode is so important for anyone dealing with chronic pain, or anyone who loves someone who is dealing with chronic pain, or even someone that you know who lives with chronic pain, because while ketamine is not a magic bullet, Kristen's work shows that it can be a miracle level breakthrough when it is used when it is used correctly. So, let's get into it. And by the way, real quick shout out to Kristen and her clinic. If you're in the Denver area, or if you're willing to travel to the Denver area, her clinic, Ketamine Pain Center, is one of the best places to get this specialized treatment. You'll hear her talk about her expertise in the episode. And we have all of those details in the show notes below. So let's get into it. Whether you're grabbing tea or you're grabbing a headphone so we can all go on a walk together, however you're listening today in the car, I'm so excited to dive into with you. Let's go. Welcome to the show, Kristen. I'm so happy to have you.
Thank you. It's great to be here.
Amazing. So we start every interview with the same question. If you could tell you before all of this anything, what would you tell her?
Oh my gosh. I don't think I would have believed it, that I would have the privilege of working today with individuals that suffer from really what is known to be the most horrible pain conditions out there on the pain scale, pain indexes, that I would have the honor and privilege to sit beside those individuals. I wouldn't have believed it. It's been such a honor and a privilege to get to do what I do.
And you are, I mean, honestly, as far as using ketamine kind of off-label from anesthetic, I mean, your clinic is back to 2016, but you've been doing psychedelic research even before that. So why don't you tell us a little bit about the center that you run in Denver?
Thanks. Yeah, we do. So my primary business is a pharmaceutical research company, Mountain View Clinical Research. And we do all sorts of different clinical trials. Right now, we are doing a lot of trials in psychedelic medicine, more for the mental health aspects of it in the clinical trials sector. So PTSD, anxiety, chronic depression, that sort of thing. But prior to, I think it was about 2013, I was doing a clinical trial for the treatment of complex regional pain syndrome. A company out of Germany, Grunenthal, was studying a drug, neurodronic acid is the name of the medicine that they were studying. It's approved in Italy, but it never reached approval here in the United States. Anyway, I was doing that trial, and I thought, oh my gosh, it'll be a tough study to enroll. We'll never find patients with this condition. And it was like the floodgates opened, unfortunately.
Wow.
Because there are many, many more people out there than we even realize that suffer from complex regional pain syndrome. So that was in 2013. And as I was, spending a lot of time with these individuals, my heart just broke for them and this pain condition that they have to suffer with every day. I suffer from chronic pain, so I know what that feels like, but I don't suffer from that type of chronic pain. And it takes pain to a whole nother level. So I, started talking to them, and in most trials, I feel like I can offer the patient some sort of educational words of wisdom. Not in this case. Patients were educating me, hands down. And a lot of them brought up the thought of ketamine being used to treat these neuropathic pain conditions. I thought, what? Years ago, I worked in the hospital and I was around ketamine in the emergency room to a kid would come in with a broken arm or leg and ketamine would be used for them. So I knew ketamine in that aspect, but I'd never heard of ketamine in an outpatient setting. So I started doing a little digging around, and there were a lot of facilities really on the coastal areas, LA area, and then Southern Florida, and started looking at their treatment programs, partnered with a physician locally here in the Denver metro area, and just said, hey, we've got to do this. We've got to figure out a way to offer outpatient ketamine to these people. And we thought there's no way that the malpractice insurance carrier would let us do that on an outpatient basis, but luckily they did. And that is how Ketamine Pain Center was established in 2016.
Wow, what a story. That's incredible, right? To have the community come to you and express not just what it is, how it operates, and then offer you their own solution, but really such a collaborative effort there.
Yeah, it really, really was. And our first patient that we infused, gosh, I learned so much from her because she had actually gone to Florida for infusions. So she already had that knowledge and wisdom and really what worked for her, and brought that to us. And we were able to collaborate with her and really kind of developed what we offer today. And I'm super grateful for her patience, her wisdom, her, just guiding us through the process as well. And we kind of learned from each other. And it's, everybody's different and unique. And the protocol does have to be tweaked a little bit per person. But I think we found a really good solution that we're able to offer a lot of people.
That's amazing. And one of the reasons I really was so excited to have this story featured on the show is because we hear about, what you're talking about, like you're doing psychedelic research for mental health. I know you have a master's in social work to offer more of the mental health aspect, but talking about ketamine for pain, for physical pain, not just chronic pain that maybe is emotion based, but really this like nerve pain that you're talking about. That's something that isn't talked about very much. So can you explain more, like, if someone's listening and they're like, I don't know if I have nerve pain, or maybe they do. Is it possible to not even know?
Sure. I think people know because it hurts really badly. It's called a McGill Pain Index. And it takes pain anywhere from, kidney stone pain, natural childbirth pain. This neuropathic pain condition, especially CRPS, ranks higher than any of those other pain things that we think of being horrible, natural childbirth, third degree burns. So it's higher than that. What's interesting about CRPS is it always starts from some sort of trauma. Typically that trauma can be surgery, and usually is for a lot of people. It's a surgical procedure, but it can also be something as minor as I twisted my ankle and now all of a sudden I have pain that's way more severe than it should be for just a twisted ankle or a sprained ankle. And so then it develops into this kind of neuropathic pain condition. So people definitely know they have it. There are other pain syndromes that are probably not as severe as CRPS, like fibromyalgia, or phantom limb pain, any kind of spinal cord injury type pain. Those are the conditions that respond well to ketamine. Somebody would just say a little osteoarthritis in their knee, or other, just a back injury where it's more musculoskeletal. They're not going to respond as well to ketamine for pain treatment. And kind of a good litmus test, however you say that word, is if you respond to traditional anti-inflammatories or even opioids, it's probably not a nerve-related pain. Nerve pain does not respond well to opioids. So that's the other downside, is there wasn't a lot to offer these poor individuals if, pain meds. And of course, now we're in this big opioid epidemic and doctors don't like to prescribe them anyway. Right. But if they didn't work, what were these people to do? And so that's where ketamine shines. And I'm glad that we figured that out finally. I'm sorry that it's taken us so long because, as we know, ketamine's been around, like since the 60s or even maybe a little bit before, but it's been around for a while, just not really used in this capacity until recently.
I know. We just keep finding new ways to use ketamine and really offer such a robust treatment protocol with just one medicine. And I think it's amazing. Okay. So someone with CRPS or other nerve pain, they definitely know they have it. If they take anti-inflammatories and it doesn't help, then it's just further confirmation that it's a nerve pain that is not, able to be helped in that way. And so what is the protocol that you offer that is helping people so much?
Yeah, I think that's important to note too, because I think a lot of people will seek out ketamine. They hear it works well for pain. So they start making calls and they go into maybe a treatment facility that treats mental health with ketamine, and they get a mental health protocol, which is about a 40-minute to 1 hour infusion, and it doesn't work. And then they are devastated because they're thinking there was one thing that was going to work, and I went and tried it and it didn't work. And that's because the infusion protocol is very, very different for pain versus mental health. So a pain infusion is typically about a 4-hour infusion. I've heard some centers do a 3-hour, but I think 4 is really more the gold standard. And you're giving a much, much higher dose than you would in a mental health infusion. So a longer duration, higher dose, and initially more frequent. I'll tell you about a patient of ours that was just, he is the rock star of our clinic. And what made me think of it is because he had the 10-day protocol. So it's 10 days in a row of a high dose ketamine infusion. Now, unfortunately, that's usually pretty prohibitively expensive for a lot of people. And so there has been some discussion and revision of the protocol, and we can scale it down to maybe 4 days instead of 10 days. But if it's feasible at all, 10 days is really the best way to do that induction of ketamine. And then from that point forward, individuals only need to come back, say, once every 3 months, or, some people come back once a month, others once every 3 months. Some people can push it out a little bit further. Everybody's so unique in how long the pain relief lasts before they need an infusion, but they never have to repeat that 10-day or even that 4-day again. It can be just maybe a 1-day booster instead of, the 10 days like we started with.
So is the 10 days, what happens in that 10 days that makes it so that they never have to come back?
Yeah, it's magic. No.
Obviously.
No. So with these pain conditions, there are receptors called NMDA receptors. I think they stand for N-methyl D-aspartate, or however, NMDA receptors. And we are blocking those receptors with ketamine. As we block them, that stops what is called the central sensitization. I can't say that. Central sensitization pain. Yeah.
Got it. There's certain words that are just not meant to be said out loud.
I know,
let's be real.
Exactly. So it blocks those receptors. And I think just that prolonged blocking of those receptors that kind of stops the pain signals and then reboots the system, just like it does in mental health. We're rebooting your brain, basically. So people with CRPS, or say you can even think of it as like even the individuals with phantom limb pain. So their pain may be primarily, showing itself in the, like, say, maybe your right hand or something. That hand is so terribly painful. Well, in the beginning, before people really understood what CRPS was, they would electively amputate that arm or that hand because that's how severe the pain was. Whoa. Unfortunately, after the amputation, the pain was still there because it's not really in your hand. It's in the brain and spinal cord. It's just manifesting in your hand. And then
Wow.
CRPS can move. It can start in your right hand, and maybe it moves to your left hand, or maybe it moves to a leg, or eventually it could move to whole body. But that's why it's so good to understand these medicines like ketamine that work in the brain and spinal cord, because that's why they're going to block the pain signals then in the hand or wherever the CRPS is manifesting.
I'm like floored right now. I know so little. I'm learning so much about CRPS right now. It can start. So is it? So people would have this intense pain. They would maybe get that limb amputated, and then the pain would continue. Would it continue in the phantom limb, or would it continue by kind of jumping around the body, or both? Or
Both. Yeah, both. All of the above. Yeah. That's the bad thing, because the where the pain signals are actually starting is in the brain and spinal cord. So that's why it's, using a medicine like ketamine to block those receptors in the brain and spinal cord is so amazing, because then it's going to help reduce the pain. I think everybody with CRPS would still say they have some pain, even after a ketamine infusion, but maybe you're taking them from a level of 10 where they're almost bedridden to say a level of 5 or 6, and they can actually be functional. I mean, I remember a woman that was a patient years ago, and when I tell you she literally brought a piggy bank in to pay for her ketamine infusions, I'm not joking. Like, that's how, of a cost factor this was for her. And even after the 10 days, she wasn't having much pain relief. And I just felt horrible, because I really, really wanted to see, her to have success. And so she leaves, she comes back for a follow-up in a couple of weeks just to meet with the physician. And she was wearing makeup. She was wearing clothing that was actually touching her skin. She told me she had been cooking for her family for the first time in, years. And I was just, it's this huge sigh of relief, because finally she was able to be functional. So that's what I tell people too. Yes, we get fixed on a number, and I'm going to ask you your pain scale number every time you come in, but it's way bigger than that. Like, if I can get your pain down to a 6 or 7, but you're cooking for your family, you're wearing clothes, things like that, is just, okay, it makes it all worthwhile then.
I mean, yeah, quality of life, right? That is, all of those things are quality of life. Okay, I have some questions though, because you mentioned there's a higher dose and there's a longer infusion, right? So you said 4-ish hours and 3 to 4 hours, and then a higher dose for those 3 to 4 hours. What is the higher dose? Because I know the dose, it depends on, but it's like 0.75 milligrams per kilogram for the average sort of infusion dose. But what are you working with that's even higher than that?
So I would say our average patient, and it's going to vary a little bit on body weight, of course, and on tolerance. So I have some tiny little ladies getting 700 milligrams of ketamine, and some bigger guys that are only getting 300 milligrams of ketamine. So it's going to vary a little bit. But I would say the average dose for us, for our site, and other facilities do differently, or different infusion protocols and dosages, but ours is around 500 milligrams over the 4 hours.
So that's like just over 100 per hour, or or 125. That's math. There we go.
Yeah, I would say that's probably about average. Yeah.
Okay. And so I'm curious, because I mean, starting someone off, regardless of weight, at that dose is kind of intense. But with these people with the CRPS and fibromyalgia and the nerve pain that you're treating, is it that they have a higher tolerance to just anything? Like, is it that they can handle higher doses of ketamine because of how intense pain they live in?
They're pretty sedated.
Okay.
They're definitely pretty sedated. And if we're doing a 10-day protocol, I don't start you out at that high dose.
Okay.
We would kind of baby step up. In fact, I joke with people when they first come in that the first day we're doing a wine tasting. The second day I'm pouring you a full glass. And the third day we're going to tequila shots. So that's kind of how my description is. And then the 4-day protocol that just came out, that's a little different. We dose escalate every hour. of their
Whoa.
infusion that way. I've seen some success. I still say the 10-day works way better if it's doable. And unfortunately, we still live in a time where insurance is not covering
I
these
know.
costs. But if it's possible, that's really where the magic happens. Is just that I think the longer duration of saturating those NMDA receptors, and for as many days as we can, initially, we're going to have better results moving forward.
Yeah. So you're not going for the psychedelic dose. You're overshooting the psychedelic dose and going into sort of like a sub anesthetic dose.
Correct. Yeah, we definitely do want them to experience that kind of disassociation from mind and body. Like that, the magic happens there too. If I can't get an individual to kind of really disassociate mind and body, I'm not going to have as good of results, even though I did saturate those NMDA receptors. So there is still something to that kind of psychedelic piece to it. That's why it's called a dissociative anesthetic instead of a psychedelic. We really want them to disassociate a little bit. And then after that, they can be sleepy. They can sleep through their infusion. It's fine. There's no way, like sometimes with ketamine for mental health, you talk about ketamine assisted psychotherapy. We're not doing ketamine assisted psychotherapy in this. There's no rational conversation that's going to happen on those doses of ketamine for most people.
For sure. Yeah, absolutely. Well, it's also not necessarily the point to like extract, the golden wisdom from the subconscious mind. The goal is to reset those NMDA receptors. So that's really different.
Yeah, absolutely. Absolutely. It is kind of what prompted me, though, to go back to grad school and obtain a degree in social work, because working with these CRPS patients, they all had some sort of physical trauma. Clearly, that's how the CRPS developed. But it seemed like not only are you dealing with the mental health struggles that come with living with such a chronic pain condition, but a lot of individuals, it seemed, had some significant psychological trauma in their past. So I thought, if I could be better prepared to treat both physical and psychological trauma, then maybe we would have even better success with the physical relief.
Did you find that? Did you find that helping with the psychological trauma helped with the physical release?
I think it's a work in progress. I wish I had a, full service facility, and maybe that's something I aspire to have, where we do, because right now our main focus for individuals coming in is obviously to knock that pain down, right? But if we could do some sort of talk therapy as a piece of that, I think we would have overall better success as well. Unfortunately, the way the model has been right now, since ketamine already costs so much, or ketamine infusions cost so much, and I try my best to keep costs as low as possible, we haven't really been able to dive into carving out the time piece to offer mental health services outside of when they're here in my facility. So as they're waking up, yes, we might talk about it. And sometimes during the infusions, people will start to talk about, some trauma in their past, and then we can sort of reset those neural pathways during their infusions. But for the most part, they're usually pretty sedated.
Yeah. I mean, it takes, with the clients that I work with specifically for ketamine for mental health, it takes them a while to come out of that state. I don't work with clients the same day as their infusion. I meet with them the day after or 2 days after,
Mm-hmm.
depending on scheduling. And yeah, I can't imagine trying to do anything after such a high dose for
Right.
that many hours. It takes time to land back on planet Earth.
Yep, absolutely. And we're giving them, because it's a higher dose, we're typically giving them other medicines too that might be a little more sedating. So whether that's Benadryl or, Phenergan for nausea, or Versed because they're a little anxious or their blood pressure is going up, all those other ancillary medicines also create them a little more fatigue and inability to kind of have a conversation and rationally.
I'm so curious. Okay, because now there's a whole cocktail, right?
Yep.
Now
Yep.
it's not just the ketamine. Now you have a whole cocktail. These people are in extreme nerve pain. They're coming in. What is day 10 like for these people when they're like doing this? I mean, 10 days in a row is extreme. It's a lot.
Yeah, they are exhausted. Exhausted. There is not one person that isn't glad 10 days are over. Most people think, oh, this will be great. I'm just going to go lay in a chair and somebody's going to give me ketamine and it's going to be lovely and I'm going to see purple elephants all day. No, it's exhausting. So everybody, in fact, day 5, and then they usually have the weekend break. People are so grateful for that weekend break and then starting again the following week. But they're usually
Wow.
good and like, I'm over this. I'm ready for it to be done by the time they finish. But, I mentioned the gentleman before that is really our biggest success story. And I can tell his name because he's given us permission. And I hope you get the chance to talk to him at some point yourself. But his name is Kevin. And Kevin came to us initially not having walked or put on a shoe for 5 years. He had done really everything else to treat this pain, from having a spinal cord stimulator in place, different types of other therapeutic modalities, some different medications, and decided, what the heck, I'm going to try ketamine. So here he comes in on crutches and not wearing a shoe on one foot. That's where his CRPS primarily presents itself. After that first week, he came in wearing a tennis shoe. And then after the second week, he came in walking for his, I think day 8, he came in walking without the use of crutches for the first time in 5 years.
Wow.
So that's why I say, the 10 days is really the gold standard if possible, because had we stopped at, say, day 5, would our biggest success been just getting him in a shoe again, which would have been lovely. I mean, but seeing him then be able to come in and walk after day 8 of the ketamine infusions. And now he's working, and he's not only working, he's working a manual labor job now. So it's just fascinating to me how it can, really take somebody from a life. And he was young. I think he was 20 when he had his injury or something around there. And to think that the rest of his life was going to be spent not being able to put on a shoe or walk. And then now he's able to work. It's just pretty incredible.
It is so incredible. And I think that's also what I'm seeing a lot with these stories of ketamine success, is that so many of these stories are, this was their final hope, whether it's a mental health journey or a nerve pain journey or whatever it is. They tried so many things on their way, and then we're like, all right, well, okay, fine, sure, I'll do ketamine. I'll do anything at this point, And so do you think there's a way, or even if it's useful, to get ketamine as like the first therapy that people try? Do you think that would be helping people?
Absolutely. Absolutely. I think it would save, it's not clearly nothing's going to be a cure. And if somebody goes to you and tells you I have the cure for whatever is ailing you, that, walk away, because we can't project that. But I do think if people were able to use ketamine as a first line treatment, especially early on, say they have twisted that ankle, and, their doctor put them in a boot or something for a little while, and that pain is still there beyond really when it should be, and much higher. They call it hyperalgesia. So it hurts way worse than it should hurt for a typical injury. Get ketamine, you're going to knock it down. And that's, I've had some patients that maybe had to go have a dental procedure that have CRPS. They go have that dental procedure. They don't want to do it because any other kind of painful stimuli can make CRPS spread. But if you have to do it, you have to do it. So you go have that dental procedure and then quick get into me for a ketamine infusion, and we can stop that CRPS, hopefully, from spreading and making that pain condition even worse. So yes, I think first line treatment might save people years and years worth of agony, hands down.
Yeah, and even, talking about Kevin, he was so young and still is so young and but to have that intervention, when he's still able to, get to work and really make use of his able-bodiedness that was so fresh to him. I can only imagine what's possible for other people.
Right, absolutely. And unfortunately, I don't think we're going to see a day anytime soon that the insurance companies are going to jump on the bandwagon and start paying for pain infusions. I mean, they might. We are seeing that a little bit more with mental health, but there have been more studies written about the use of ketamine for mental health. And, that's usually, I think, where the insurance companies get their data is from large randomized controlled clinical trials like I do in the other part of my business. But since ketamine's been on the market so long, I can't think of many companies that would want to spend the millions of dollars it takes to do the, randomized controlled clinical trials so that insurance would pay for it, unless we just keep advocating for it. And maybe
Right.
through that, and if they see, paying for ketamine versus paying for an $80,000 spinal cord stimulator that has all kinds of potential side effects. It's a very worthy and valid procedure, and I'm not saying it shouldn't be done, but I'm saying, I really wish, insurance companies would pay for a $700 ketamine infusion, and since they're paying for the $80,000 spinal cord stimulator.
The way insurance companies work will never make sense to
I know.
me. I mean, because even so with this, right? Like I'm always baffled that insurance companies want nothing to do with preventative care, right? So it's okay. You don't want to spend, say, whatever, $3,000, $5,000, $300 on something that's preventative care. But without this preventative care, now you have like a $300,000 issue, and that's okay. And so, but with this, with nerve pain, with CRPS, with all the things that you're talking about here, it's not preventative. It's literally like Kevin got back into the workforce, right? Like Kevin is able to, if all we are, capitalistic hamsters and wheels, it's like this is getting people back into that wheel where they're able to contribute. It never makes sense to me.
Right. No, I get it 100%.
Yeah, it's not preventative care, and it is so much more cost effective than anything else. I wonder what it will take for the insurance companies to really wake up to covering ketamine, whether it's for mental health or for pain or nerve pain or whatever it is.
I know it'll be interesting to see. I do think there is some hope maybe in the future with other psychedelics being used for the treatment of these chronic pain conditions. There are a few papers written out there now. If you search that there was some use of psilocybin for chronic pain, and then in fact, I wrote a study. I haven't been able to take it much further. So if there are any listeners out there that know how to file IND applications, woo, hit me up. But wrote a study using MDMA for pain, and I project that it will be just as beneficial, maybe even more so than ketamine for nerve pain.
Interesting. Is that more because MDMA is really good? I mean, it's good for so many things. Is it the MDMA for nerve pain? Is that more physiological or emotional, or is it just the perfect cocktail of both?
I think similar to ketamine, we're going to see that it's the perfect cocktail for both. And I think there are some companies out there that are starting to look at MDMA for pain. Like I said, I wrote this protocol probably 5 years ago,
No
and haven't
way.
really been able to take it very far. I did a couple little case studies of my own, but I wish I could tell you I came up with this idea independently and have all this amount of brilliance behind it, but it's not so. I met a CRPS patient that had used it on his own and had some pretty good pain relief.
Interesting. Wow. I mean, that would be so cool. I think when I work with people with chronic pain, there's so much self-loathing, just like, and this like war with between like personality and body, right? Like, why can't my body do what I want? Why can't my body respond to treatment? And MDMA is such a beautiful heart opening medicine, so I can only imagine for to bring it in and have someone just be like, oh, I love my pain, oh, whatever comes out of it. Yeah,
Yeah, well, and we know the body keeps a score. I
we
mean,
sure
we
do.
know that. So that's, even if it's, clearly it was a physical, something physical happened to manifest this pain condition. But if you put that on top of all the trauma, mental health trauma that has happened, if we can treat both of those things and get kind of like you said, a new perspective about our pain, even if the pain is still there, maybe we can look at it a little differently. And then maybe that decreases it as well, or at the very least increases our quality of life.
Absolutely. And it has to be in both ways, right? Like we are, Osho, I'm a longtime yogi. I've been reading the ancient texts forever. And one of my favorite is Osho. He says, what is it that you Westerners talk about this mind body connection? How can you connect two things that are not separate?
Love it. Yeah.
It's just like I often talk about it being a two-way street, right? So we can use the mind to heal the body. We can use the body to heal the mind. And when we're talking about, what is it? Physiological? No,
Yeah.
physical. There we go. Just physical disorders. We're talking about something that it obviously affects the mental health. And then it's like, we really got to clear both of those up in order for quality of life to return, for well-being to return.
Absolutely. I agree. And I hope we're finally moving in that way, not only us as providers, but more, just as a whole, in society as a whole, moving forward. That it is one and the same. Your pain and your mental health is one.
Absolutely. And I think honestly, I think that's one of the gifts of the pandemic is that it's made the conversation about mental health so much more present and so much more real and so much more open, even if it's, even if we're poking fun at it sometimes, we're still, at least it's out in the open that mental health is real, because I haven't seen that in this country, honestly, ever.
Yeah, I agree. I think we are moving in that direction, which is why, from a research standpoint, I'm very, very busy with all these fun mental health studies.
Amazing. I love it. And then if someone is hearing this and is, thinking, okay, I have nerve pain, maybe this is something that can help me, where can they learn more?
So I am thrilled to talk to anybody anywhere in the U.S., the world. Can give me a call, give me a text, email me. Happy to talk to them just about ketamine as a whole, because it breaks my heart, like I said earlier, when people will sort of be tricked into going and maybe trying a low dose mental health. Here, let me give you a 1 hour infusion, and then they're just devastated because that one thing they were holding out for then again didn't work. So I certainly am not sharing this information to gain more participants at my office, although I would be happy to treat anybody. But just to educate people more about what to go and ask for, calling around. Luckily there are a lot of ketamine infusion centers now throughout the U.S. So, interviewing each ketamine infusion center, asking the right questions, kind of what is their protocol? Is there somebody that's going to be in the room with you? What to expect? What doses, that sort of thing. I would be honored to talk to anybody about it.
Amazing. Yeah, maybe what we can do is work to put together a guide that people can access of the questions to ask ketamine clinics for, specifically for pain, because it is a very different protocol as we're learning here today. And that is so generous for you to offer your time up in that way. But I get it. It's when you see someone go from such a low quality of life to such a high quality of life, and knowing that there are nuances for when it works and when it doesn't. So I appreciate you offering that up. We will have all of your information in the show notes so that people can take advantage of that generous offer and find you if they're in Denver. I absolutely recommend coming to your facility.
Oh, you're sweet. Thank you so much. It's been a fun journey for sure.
Amazing. And maybe another time we can have you on to talk about some of the psychedelic research that you're doing, because that's something that we're expanding on the show, as well as talking about other psychedelics and other research things. And I know you run, that's the other company that you run side by side is clinical research. And you mentioned you're doing a lot with psychedelic research now.
We are. It's an expanding field, and it's an exciting time to be in research. It's definitely re-energized me. Instead of just, another clinical trial for high blood pressure, another clinical trial for osteoarthritis pain. We're like, here, let's study LSD for anxiety. Why not? So.
Heck yeah. Okay. I'll reach out. We'll have you back on the show to talk about that.
Okay, sounds good.
Amazing. Kristen, thank you so much for your time and your just generosity today and always with everything that you've been doing for the past 30 plus years as, a medical professional, just like seeing someone and meeting someone that still like has their full heart in the medical field is rare. And it's energizing to me. So thank you for who you are in the world.
Oh, thank you. It's my pleasure.
Thank you. Thank you so much for joining me on this episode of Ketamine Connections. I hope you found our discussion insightful and empowering. Remember that understanding the subconscious mind and how to make the most of ketamine therapy can truly transform someone's healing journey. And if you enjoyed today's episode, please take a moment to share it with your friends and family and anyone who might benefit from this information. So few people considering ketamine therapy are fully educated about its potential and the impact that it has on the subconscious mind. Your share could be the key element to their transformation. Don't forget to subscribe to Ketamine Connections so that you never miss an episode. And if you have a moment, I absolutely adore reading your reviews. So your feedback really helps me feel like this is an engaging exercise. Otherwise, I just feel like I'm talking into empty internet space. So your review really helps light me up and also helps me reach more audience. So I would appreciate one if you're willing. And please use the link below to submit any questions or topics that you would like covered. I cannot wait to hear from you and to co-create this journey together. Until next time, keep exploring, stay curious, and embrace the possibilities that are available in this moment right here, right now. Thanks so much. See you next time on Ketamine Connections.